We are providing therapy 365 days a year, 7 days a week. Every day is a therapy day.
Our facility here enables us to bring in medically complex, critically ill patients recovering from a catastrophic injury, stabilize them. Once they're ready to move to the next level of care, we're able to provide that under the same hospital, same roof. So we're going to take care of patients that are recovering from a wide variety of illnesses.
When you have a solid institution like Select, pairing up with Rush, that is one of the leading academic medical centers in Chicago, is a win-win situation.
The people that can benefit from coming here are patients that need an intense and coordinated approach. So we need everybody working together.
It really provides patients with a continuum of care that's not offered anywhere else.
The focus in the Critical Illness Recovery Hospital is medical stability. We're trying to get the patient weaned from the ventilator and just medically stable.
On the acute rehab side or inpatient rehab side, we tend to see patients recovering from a stroke or recovering from a brain injury, spinal cord injury.
So it's more therapy-centered. We have a multidisciplinary approach.
Led by physicians, but it also includes nursing, respiratory therapists, occupational therapy, physical therapy, speech-language pathology, dietary.
Everybody kind of works together at the same time for the same purpose, which is healing a person and ensuring we can transition to the next step.
So all of our rooms have it where they're single patient rooms, they're single bathrooms. It gives the patients a little bit more privacy, and also for the family members to come and visit and know that their family members are safe.
No patient will be left behind. We have beds to welcome everybody.
Patients can practice doing laundry, cooking, all of those little activities that we do every day and don't think about. That's what living is.
One of the things I like to do is sit down with patients and family members just to see where they're at with their health and their goals. I think our duty as in leadership or even just bedside staff is to really build those connections.
And we'll tailor a care plan to each and every individual patient.
It doesn't end when they leave our hospital. It's going to continue.
We can identify who will be the caregiver or that family member. We can train them, we can educate about the condition that the patient has and why therapy is important.
If a patient is going to have difficulty going up the stairs, we might be able to bump them up the stairs in a wheelchair and teach the family how to do that. We may be able to get a ramp.
The facility in itself it's spectacular. But a hospital is nothing without the quality of care that we deliver.
I love what I do. We treat the person as a whole.
Being out there, being able to make the relationships with our staff, being able to make the relationships with patients and families, that's what this is all about.
I'm excited about taking care of people. I'm excited about great outcomes for our patients.
This gives us the opportunity to really prove that, yes, you can take those patients who are on a ventilator, really dependent, rehab them and return them into the community.